This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub Podcast. I'm Dr. Aris, a senior attending here, and it's a pleasure to have you with us for another deep dive into the evolving landscape of our field.
And I'm Dr. Elara. Today we're looking at a fascinating new study from the journal Frontiers in Public Health, published in 2026. The paper is titled, Construction of a Comprehensive Value Assessment Framework for Renal Denervation Therapy, a Decision Support Tool for Chinese Hospital Management.
Now, some of our listeners might be wondering why we're discussing renal denervation, or RDN, on a neurosurgery podcast. But as we know, the intersection of the autonomic nervous system and interventional procedures is a core part of the modern neurospecialist's peripheral consciousness. RDN is a catheter-based intervention that delivers targeted ablation energy to the renal sympathetic nerves. Essentially, it disrupts that overactive sympathetic signaling between the kidneys and the central nervous system to reduce blood pressure.
Exactly, Dr. Aris. It's a neuromodulation approach to refractory hypertension. The study is particularly timely because as of 2024, 4 RDN products were approved by the National Medical Products Administration, the NMPA, in China. 1 is imported and 3 are domestic. But because these have only been commercially available for about a year, there's a real gap in clinical experience and operational management.
That's a common hurdle. We see it with new neurointerventional devices all the time. The authors point out a medical device lag in value assessment compared to drugs. While drug assessment frameworks are well established in China, medical devices are trickier because of shorter product life cycles and the dynamic interactions between the device and the operator.
Which is why this paper is so important. The researchers used a multiple criteria decision analysis, or MCDA, to build a framework that helps hospital managers and clinicians decide which RDN devices to procure. They didn't just look at price, they looked at everything from innovation to management value.
Let's talk about that methodology. It wasn't just a simple survey. They used a literature review and focus group interviews to identify criteria, then applied the Delphi method to refine them. Finally, they used the analytic hierarchy process, AHP, to assign weights to each criteria. This involved both cardiologists and non-clinical professionals from hospitals across different regions.
And the framework they built is quite comprehensive. It's structured into 3 levels, 7 primary domains, 16 secondary criteria, and 30 specific subcriteria. Dr. Aris, what struck me most was the distribution of the weights in those 7 first-level domains.
Right. If we look at the hierarchy, efficacy was the top priority at 23.26%, followed closely by safety at 21.83%. Together, those clinical outcomes account for nearly half of the total value. In the neuro world, we always say safety first, but here they are almost neck and neck.
It makes sense for an innovative therapy like RDN. If it doesn't effectively lower blood pressure in patients with refractory hypertension or drug intolerance, the innovation doesn't matter. But what was surprising to me was that cost was actually at the very bottom of the list, weighted at only 6.01%.
That is a significant finding. It suggests that for high-end, innovative medical devices in the Chinese hospital setting, clinicians and managers are prioritizing clinical performance and qualification and suitability, which was the 3rd highest domain at 16.84%, over the upfront price tag. They want tools that work and fit their specific institutional needs.
Let's dive deeper into that qualification and suitability domain. For our residents listening, this isn't just about the device itself. It includes things like the manufacturer's training programs and technical support capabilities. The paper mentions that because these devices differ in design features and ease of use, there can be heterogeneity in procedural performance and outcomes across hospitals.
That's a crucial point. If a manufacturer provides superior training for the ablation procedure, that contributes directly to the value of the device because it reduces the learning curve and potentially improves safety. Speaking of safety, the paper emphasizes that safety isn't just about the procedure, it's about the long-term integrity of the renal arteries.
And then there's the patient value domain, which came in at 15.18%. This covers things like patient compliance and the potential to reduce the burden of daily antihypertensive medications. For a patient who is drug intolerant, a one-time interventional procedure that modulates their sympathetic system has an immense subjective value that traditional cost-benefit analyses might miss.
I noticed the innovation domain sat at 10.65%. The authors noted that over 500 devices obtain innovation designations from the NMPA annually. This framework helps distinguish between a true breakthrough, something that changes the treatment paradigm, and a simple incremental update.
It also touches on management value at 6.22%. This is where the hospital administrators come in, looking at how the device fits into the hospital's clinical development and resource allocation. Even though it's a lower weight than efficacy, it's still part of the decision support tool that makes the study so practical.
So, looking at the results, the prioritized domains are efficacy, safety, and qualification and suitability. For a neurosurgeon or an interventionalist, this confirms that the value of a technology is fundamentally tied to its clinical evidence base. The paper mentions that these 4 approved devices vary in the richness of clinical evidence.
Exactly. Some have more robust trial data than others. By using this MCDA approach, a hospital can score a device like the imported one against the 3 domestic ones in a way that is transparent, accountable, and evidence-informed. It moves the conversation away from, "we like this brand," to, "this device scores higher on our weighted assessment of efficacy and safety."
It also addresses the health budget constraints and the pressure for medical cost reductions. If you can prove that a device has high patient value and management value, it's easier to justify the procurement of a more expensive but more effective innovative technology.
The authors conclude that this framework serves as a reliable and scientific tool for procurement reviews. They argue that in the absence of a standardized assessment, it's difficult to compare RDN devices based on a single dimension like cost-effectiveness.
It's a holistic view. As we see more neurointerventional devices for stroke, aneurysm, and even functional disorders like this, we're going to need these exact types of frameworks. You can't just look at the price of a stent retriever or a pulse generator. You have to look at the training, the safety profile, and the long-term patient outcomes.
Before we wrap up, let's recap the weights for our listeners who are taking notes for their management rotations. Efficacy at roughly 23%, safety at 22%, qualification and suitability at 17%, patient value at 15%, innovation at 11%, management value at 6%, and cost at 6%.
It really highlights a shift in the Chinese healthcare landscape towards value-based purchasing rather than just low-bid procurement. It's a sophisticated way to balance clinical development, patient needs, and hospital resource allocation.
This study, Construction of a Comprehensive Value Assessment Framework for Renal Denervation Therapy, is a great example of how public health methodology can directly assist clinical decision-making in the intervention suite.
Absolutely. It's about making sure that the innovative tag actually translates to better care at the bedside, or in this case, at the cath lab table.
Well, that's our 10 minutes for today. A big thank you to Liu, Lin, and the rest of the team for this work in Frontiers in Public Health.
Thanks for joining us on the Neurosurgery Hub podcast. Stay sharp, keep questioning the value of your tools, and we'll see you next time.
Goodbye, everyone.